Guys, in this video I wanted to talk a little bit about pressure sores or pressure ulcers. Probably one of the biggest things you got to worry about if you're in a wheelchair or if you're paralyzed. You're sitting on your butt all day long, which basically means you're not getting off your skin. So one thing you have to do is make sure that you get off your skin as much as you can just to get that blood flow to your butt. It's a big problem if you get a pressure sore. You're going to be sitting in bed on your belly for up to a year. I mean, it can be bad. It just depends how bad the pressure sore is. But you don't want to do that. You don't want to be bedridden. You don't want to be, not able to go to work, not able to enjoy your daily routine. So to avoid that, just every half hour, as much as you can, just try to get off your butt. Whether it be just a lift like this, or even just if you're rocking side to side, you're getting that pressure off that skin. I know for some people, if you get into your daily routine, you're going to forget to do this. If it helps, set an alarm. Anything you can do. I mean, even though that's annoying, it sure beats sitting, in bed for 6 months to a year trying to heal a pressure sore. This can be really hard for people that are quadriplegic. If you don't have use of your hands, you can't lift yourself up. I know a lot of chairs will tilt back. I see a lot of quads do that. It just puts the pressure, instead of on your butt, you're getting more pressure on your back, so it's just taking some of that weight off your butt, which is really good. Another problem is if you're in a wheelchair for a long time, keep an eye on your cushion. You don't want to let your cushion fall apart, because if it does, basically you're sitting on a hard surface and you can get a pressure sore a lot easier. Another thing is if you're in the car, if you're doing a road trip or something, you might want to get an extra cushion just for the car, so you're not sitting for too long getting a pressure sore or potential pressure sore. That's basically it. Just make sure you're getting off your butt as much as you can. You also want to check your skin too. This is actually, I got this from Craig Hospital. This is just a mirror, so you can kind of reach behind and see, maybe use this once a day. I know I don't do that as religiously as I'm supposed to. I'll have my wife check my skin at least once a week, just to see if it's, if there's any sign of redness. And one thing you can kind of do is if you press on the skin and it turns, if it's red and it turns white right away, there's been pressure there, but it's not a horrible thing. If you press on it and it stays red, there's been pressure on it for a lot longer, and that's a sign that you really need to probably stay off that skin, at least for a little while, just to kind of let the blood flow and do what it's supposed to do. So if you have any questions, just let me know. Thanks a lot.